Good morning, everyone. This is Natalie Kapp, and it's a couple minutes after 10, so I think we'll go ahead and get started. I want to welcome everybody to our Safe Abortion Commodities work stream. And we have a very special presentation today from IPPF. And I'd just like to start by kind of setting a few of the ground rules that we usually do for the webinar, just so that we're all on the same page. And then I'd like to go around and have everyone introduce themselves, and just so that we know who's on the call, and so that our presenter also is aware of everybody who's participating. So if you could leave yourselves on mute during the presentation, that just helps with sound. What we'll do is we'll take questions at the end of the presentation, which will be about 20 or so minutes. And you can either save your questions and raise your hand, which is a function here on the screen of the webinar, or you can just type your questions as you go in the chat box, and the Catherine, who's our presenter today, will read them out, and she'll answer them at the end of her presentation. I also just want to remind everyone, in case you haven't seen, because this is a new announcement since our last discussion or our last workstream call, our next annual meeting, the general meeting for RHSC, will be in Nepal in March, and I think the dates are like the 22nd to the 25th or something like that.
The 25th to the 28th.
Oh, thank you. I'm so sorry. Okay. And with that, I'll turn it over to Jen, who's my co-chair for the Safe Abortion Supplies workstream, and she's going to introduce Catherine. Oh, actually, I said that we would have everybody introduce themselves. Let's do that first. So. Can we start with the A's? If your name starts with A, go ahead and just introduce yourself.
Hi, if that's the last name starting with A, this is Sophia Hassan from the coalition.
Great, thank you.
Yes, and hi, this is Åsa Andersson from Swedish SIDA, working as the program specialist on health and sexual and reproductive health and rights.
Hello, everyone. This is James Ayers from PSI.
We'll move on to B's. Welcome, everyone. Brian, maybe?
Yeah, Brian McKenna from the Reproductive Supplies Coalition.
John Townsend from the Supplies Coalition.
Great, welcome.
Tracy Brett, representing DKTNT.
Hi there, it's Jason Bauer from Murray Stopes International.
Great, welcome, thank you.
Hi, this is Eleni from the Clinton Health Access Initiative.
Great to hear from Chai. Florence, maybe? Can you say hello?
Okay. I thought it was, hi, this is Florence from Concept Foundation, and I'm the program officer for the the safe access abortion.
Hi, everyone. This is Suzanne Fournier from Children's Investment Fund Foundation.
Hi, this is Katie Footman from Mary Stopes International.
Good morning, Katie.
This is Andrea Fernio from PSI.
Good morning, everyone. This is Christopher Hammond from IPPF.
Great, welcome. I just got a message from Catherine Anderson at IPPF who says that she says hello, but she doesn't have a mic on her laptop this morning, so I'm speaking for her.
Hi, this is Alice Cartwright from University of North Carolina in Chapel Hill.
Great, welcome.
Good morning. This is Adrienne Marinkovic from the Susan Thompson Buffett Foundation.
Lovely.
Hi. Hi, this is Madhavi Bajajari from IPPF Nepal.
Great, welcome. I think we're getting down to the N's and M's.
Hi, this is Danny Murphy from Women Deliver.
Hello. Peter, do you want to say hello? See, you're there. Okay, great. Anyone else able to speak up?
Hi, this is Nora Quesada from the LAC Forum.
Hi, this is Inga Platais from Genuity Health Project.
Hello, I'm way down in the alphabet, but this is Hans Vemmer, Concert Foundation.
Hi, Hans. Wonderful. Well, it's good to hear from everyone. I think with that, I'll turn it over to Jen.
Webinar in your, sorry, thank you, Natalie, and thank you everyone for joining this great webinar in your respective time zones. I'm really delighted this morning to be introducing my colleague, Catherine Kilfitter, who is going to be presenting on IPPF's recently released Global Medical Abortion Products Database. So huge congrats. It was very exciting, and I know there was a lot of chatting and email conversations going on last week, and people are really excited about the database being out there. So we're looking forward to hearing more about how it works and how it works today and how it will work more in the future. And just to give you a little bit of a background on Catherine, she has worked at IPPF's central office in London for 9 years. She's currently the program advisor for their Global Comprehensive Abortion Care Initiative, which is currently working in 14 countries in Africa and Asia to understand safe abortion and contraception. And before joining this program, Catherine worked in the monitoring and evaluation team at IPPF. So without further ado, Catherine, I will hand it over to you to tell us more about the Medical Abortion Commodities Database. Thank you.
Thank you, Jennifer, and thanks everybody for your attendance today. I really appreciate being given the opportunity to present this database in this forum. And just before I get started, I just wanted to take this opportunity to say a big thank you to those of you who have supported or advised on this project in one way or another. It could not have come together without the collaboration. So from so many of your organizations. So thank you very much. So as many of you know, we launched the Medical Abortion Commodities Database on Friday, the 28th of September. And so it's brand new, and which is why I was really excited to be able to present it to you guys today. I just wanted to give a little bit of a background on the database before kind of looking at it a little bit. And before, I just wanted to give some background as to why, and I don't think that this is really an audience where I need to sell the why it was important, but just to give you kind of from IPPF's perspective and a little bit of the history and how it came about. So as part of our service delivery monitoring, we look at cases, if we have cases of complications following a medical abortion. And so there's a systematic review of those. And in some cases, we noticed that there were potential issues happening with the misoprostol being used. So we took some samples and independently tested them from some country programs, and those revealed quality issues. And then that plus the sort of documented evidence on misoprostol's vulnerability to degradation, that kind of combined gave us some challenges in recommending appropriate commodities to use in our country programs. And then we just kind of thought, well, and I say we, and actually, as Jennifer mentioned, I was in another team at the time. So this was a few years ago, and the colleagues in my team now put their heads together and thought, you know, there's no single source for this type of information, and it's really challenging. So wouldn't it be great if there was some kind of database? And that's how it started. So we decided this is not a project we could ever attempt to do on our own. And as I said before, collaboration has truly been the key to being able to pull this off. So we entered into formal partnerships with Genuity Health Projects and Concept Foundation. And the IPPF team also included technical consultants. And so we decided on the main objectives of the project. The first objective, quite simply, is to increase access to comprehensive country-level information on quality medical abortion commodities. And the assumption is that if this objective is achieved, we would be able to support efforts to increase the availability of quality medical abortion commodities in countries for safe abortion programs. What is the Medical Abortion Commodities Database? Some of you will have probably already seen it. Some of you were probably involved in the beta testing. But for those of you who are new to it, I'll just give a quick overview. The database is an online searchable database of misoprostol, mifepristone, and the combi pack available at the country level. And there's a few issues that are really important to understand, and in terms of how we are defining the commodities on here. One important aspect is around quality, which I'll go into a bit more detail in the next slide. But we decided as a group to only include misoprostol that had sufficient evidence of quality, and also the combi packs. And what we've decided for the combi packs is if the misoprostol component of a combi pack had sufficient evidence of quality, that we would put it on the database. The second important aspect was around availability. So this database also includes commodities that are available at the country level. And a quick note on indication, just because there's always questions about this. We are not including information on the registered indication of misoprostol in each country. We're aware that there are some countries that have misoprostol registered for other indications, but we are not specifying that. What we do say on the database, we do have disclaimers around that to say that that you check with the local laws and policies of your country, but we're not giving guidance on registered indication. So a bit about the quality. I mentioned that we were not including all misoprostol products that were found. This was kind of divided into a couple of sections here. So the first criteria is if a misoprostol product has been assessed by an internationally recognized quality assurance process. So if it's met requirements and standards for the WHO PQ process, if it's been approved by a stringent regulatory authority, and then also the results of the UNFPA expert review panel process. So any misoprostol products that have those quality assurance status and that were found to be available at the country level are included on the database. And again, the combi packs that have the misoprostol, again, with this quality assurance. And then IPPF and our partners, we decided that we recognize that there are a lot of misoprostol products available, particularly in countries where there's not a quality assured product. And so we decided that it would be important to try to come up with some way to include some of them, because we know there are good products out there. So we came up with a methodology to determine other sufficient evidence on stability and clinical effectiveness from at least 2 of these criteria. So stability testing data from manufacturers, independent product testing, and data on clinical effectiveness. And just to say, at the launch, which just happened on Friday, we currently don't have any products on the database from this quality criteria. We're in the process of reviewing data, and so hopefully we will be able to add products in the future. And this is something that we are taking very seriously, and we would like to continue to be able to look at this. And the note on mifepristone is due to the fact that there isn't documented evidence in the same way that there is about misoprostol in terms of degradation when exposed to humidity and moisture. We've just decided that the registered mifepristone that's available in country will go on the database. So the quality component doesn't, for our database, it does not related to the mifepristone. And the second key component, in addition to quality, was availability. So how did we determine availability? We did a massive structured in-country data collection exercise in select countries. We were unable to do it in every country in the world. We had to prioritize, and we prioritized based on the countries where we know that there's either lack of information or lack of availability of quality products. With partners, we developed a data collection form and some guidelines to accompany that. And data collectors went to a couple of sites within a country and visited outlets such as pharmacies and public and private health facilities, and collected data on all of the medical abortion commodities that were available. And we compiled all of this data, cleaned it, verified it, and then we extracted from that the data that would go on to the database. And that was the main availability determination, but we also have information from social marketing organizations, distributors, and even some manufacturers. So this is what the database looks like. I've decided not to do a live demo just because I thought it was too risky in case anything happened. So I've got a few screenshots, but please do, if you haven't had a look at the site, please do so after this. So you can see the map, which is a searchable, a clickable way to search by country. And the countries that are highlighted in blue are the countries for which we have some data. And I just need to qualify that with the fact that we don't have complete data sets for these countries. So we are up to 93 countries now. So that's not to say that we have a full picture in 93 countries. It's just that we have at least something for 93 countries. And you can see here that you can search by country, you can search by the type of commodity, and you can also search by brand. So for example, if we were to type in Kenya in this and then hit submit, this, and apologies, it's very small, but this is just to, I had to shrink it to fit it on the screen. This is just an example of what one of the search results looks like. You can see for the registered misoprostol and Combipac brands, you can see an additional column on the right for quality assurance status. So that will show whether it was SRA approved, WHO qualified, or for the other two, which we currently don't have up here yet. And again, for mifepristone, we don't have that column. And just a note on the quality assurance of the Combipacs. I'm aware that it's currently quite confusing the way it's done, and so we are in the process of either adding another comment or a footnote or something just for the products that are included based on the quality of their misoprostol. We will have some clarification around that, so it won't be so confusing and present inaccurate information. Another thing to just point out is that all of these, everything that looks clickable and linkable, it is. So you can, for example, if you were to click on MisoClear under misoprostol, it would take you to the page on MisoClear, which also shows you all the countries it's available in according to our data collection. And then again, if you clicked on any of those countries, you would come to a list that looked like the one for Kenya that we saw. The website was built based on a mobile-first policy at IPPF to use responsive design. So this is what it looks like on a phone. And also, we assumed that people are likely to be using it from a smartphone and not necessarily sitting at a desk using their desktop. So one big question that people have is, who is the database for? The primary target audience for this database is public health professionals and others working on safe abortion programs. We realize that anybody can end up on the site, and we've taken into consideration all the various other groups that might use the site, but this is really this was our main intended user of the site. This slide just gives a few examples of how we see it being used, and some sort of examples. So in terms of the service providers, program managers, procurement personnel, we see them using it to identify quality products that are available in country. For advocates and policy analysts, we see it being useful in terms of defining advocacy strategies, priorities, partnerships. And for funders and fundraisers, we think it might be useful to understand the market and where to invest resources, and for fundraisers in particular, where to target our asks. There's also been a lot of questions, and so I thought I would include a slide on what the database is not. So this is not a service providing website. We're not giving counseling or clinical advice to women, and we're not pretending to be a service providing website. We do recognize that women can end up on the site, and so we do have external links to resources for them, which I can show you in a minute. This is it's not a complete market availability mapping for medical abortion commodities. We do recognize that there are a lot of products out there. In no way are we trying to say that this is the full picture. We've just focused on the quality and availability aspects, and we don't want to undermine the positive outcomes of other products that are out there either. This database is not an endorsement or advertising by IPPF of particular brands. For those of you who have visited the site, you'll see we have an entire section on disclaimers. So we are being very clear about that this is just an information site. Probably the most important one to talk about is that this is not a project that happened once and that now it's finished. In a lot of ways, despite this being several years in the making, this is actually just the beginning. We have plans to update it annually with with additional data sets and other kind of key features, but we also have plans to update it on an ongoing basis. In fact, since launching it on Friday, I've already made a number of changes. I've added numerous products, I've deleted some, I've changed some things. So I mean, already it's already a work in progress. We hope that this will be something that other stakeholders will continue to support and to communicate with us about. We welcome advice and also updates on availability. So we realize that the markets are constantly changing, so we appreciate any feedback or advice. I mentioned that it's not a service providing website, but that we do have links to external resources. This just gives you an example of resources for individuals, and each of these links takes the site user to an external web page where they can then find that information. And you'll see here along the top that we also have a section on abortion laws and policies, and we've also got a section on technical and clinical guidance. Again, if you notice any issues or changes, or you have any questions about those, please feel free to get in touch. So I just thought, even though the website's live, and this is kind of information that anybody can pull up, I just thought I would give a little bit of analysis based on the data that we currently have. So I mentioned before that we have data from 93 countries. Again, not full data sets, but at least something in 93 countries. So for misoprostol, we found products in 75 countries, and that was 15 unique brands. And it looks a little bit surprising that there would be 93 countries, but only 75 with misoprostol, and that's because those other countries were those where we did not finish, or we did not have a complete data set. So we do recognize that there is a lot of work to do to sort of make that difference a bit smaller. For mifepristone, unsurprisingly, it's a little bit of a different story. We found mifepristone to be available in 41 countries. Again, we did not apply quality standards to the mifepristone. Of the 41 countries, only 5 of those were in Africa and 3 in Latin America and the Caribbean. In fact, the African countries also included it was Africa and the Middle East. And then here we have, based on the World Bank income classification, we have a breakdown. So again, I don't think it's super surprising, but it's interesting actually to see those numbers and where there's a lack of mifepristone available. And we found 51 unique brands of mifepristone, but bear in mind that 27 of those were only found in India. So as for the combi pack, we found in 27 countries, and similar to mifepristone, 5 of those were in Africa and the Middle East, and 2 were in Latin America and the Caribbean. And again, a breakdown of income classification, which shows quite a similar picture to the mifepristone. And we found 7 unique brands of the combi pack. So thank you very much for your attention and your time, and again for your support. I appreciate this opportunity and welcome any questions that you may have.
Great, thank you, Catherine. Very fantastic presentation and very thorough, and thanks especially for presenting some of the data at the end, because it is nice to see sort of overarching sort of what's available and where. I just want to tee off before going into larger questions with one question. I'm just curious if you have been able to, you said you were on the database a lot on Friday and doing some updates. Have you been able to track, or are you going to be tracking how many people are looking at the database and sort of what regions that the kind of people coming to the database are coming from?
Absolutely. That's a really good question. Yeah, we will be as part of our ongoing maintenance, we're also going to be reviewing analytics on an ongoing basis. I haven't done that yet, just because I've just been adding, I've been trying to finalize and adding a few products that people are writing in about. But we very much are interested in doing an analysis of all of the analytics that are available to us.
And then one further question, and I'll to the group: Are you thinking about making any of this, or do you think it would be necessary, any of this available in languages outside of English, like maybe in Spanish or French, just as an example? Is that possible, or is it going to be too difficult?
I mean, possible technically, yes, and it is definitely something that we've been talking about. It didn't fit into this phase, but like I said, this is just the beginning, and we're going into the next phase of it. We have had conversations about it, so I think technically it's possible. We just need to put it into practice, and I can't say that we've, yes for sure, and by when, but certainly I will communicate if we do decide. I will communicate that.
Great, thank you. I'd like to open it up to the attendees for, if you have a question, to raise your hand. I see James, you have a question. I think attendees, I think I can unmute you. No, Catherine, I think you have to unmute him, or
okay,
or Alex, one of us. Alex, do you unmute?
Hi, yes, this is Alex. I just unmuted James, so he just has to unmute himself now to ask the question. There you go.
Hi, sorry, I didn't actually mean to raise my hand, but since I'm unmuted, I'll let you know that the link from your website doesn't work. It's broken, but you can type in the address and get there. Yeah, I can send you the page that I was on. But I mean, it works fine if you go directly to it.
Okay. So sorry, the link from the IPPF website.
Yeah, I just put the page in the comment box, just so you know.
Okay, thank you. I'll check that. Thanks very much.
Thank you, James. John Townsend, do you want to unmute yourself? You have your hand raised.
There we go. Catherine, thank you very much. This is terrific. I also went on the website. It looks good, much livelier than the screenshots. But I had two questions. One, kind of describing about, at least two sites. So this is a pretty low bar in terms of availability. Do you have a plan to say you'd like 10 sites in each place, or describing more clearly whether these products are available from pharmacies, healthcare, public sector sites, or NGOs? That might be helpful. Okay. And the second question is, do you have any information about price? Is that something that you're thinking about, or you'd like to stay away from that?
Those are both very good questions. The bit on price, I think for now we're staying away from that, just for a number of reasons. And then your question about increasing the number of outlets that we visit, and also specifying where we found our information? Was that your question?
Generally characterizing more the sample, just because at least two sites is pretty low, given what we know about how information about availability is not universal.
Yeah. And that was the average. I mean, there were exceptions. So in some countries where we knew there were regional differences, we went to more than just two cities or two towns. Right now, no. But that's not to say that we won't. So what we're planning to do next year, hopefully, is that if we extend the or expand the number of countries for our data collection, we would probably review our data collection form and also the guidelines that we developed to go alongside them. So that's very much something that we could consider, and I think we would need to have a look and see what we got and where, and sort of how much we think that hindered the data that we do have.
One last comment. Are you thinking of using the Reproductive Health Supplies Coalition Working Group on Abortion to continue the data collection? So you'd open it up for members of the community to update with some quality criteria, I guess?
Yeah, absolutely. Is that an offer?
It's as close as you can get.
Yeah. Yeah, I mean, absolutely. As I mentioned at the beginning, we do recognize that because it's constantly changing and that we can't ever have a full picture of what's going on everywhere at one time. We do appreciate any kind of support. So if there is data that you think you have that we're missing, we certainly will look at it and then go through our own verification process. But we haven't had any more plans to sort of formally do any sort of like MOU or anything like that, if that's what you're asking.
Okay, over to you, Natalie.
Thank you. So then our next question is from Tracy Brett. Tracy, I see your hand is raised. Do you want to unmute yourself?
Hi, yes, thank you. I just have a question on the analysis. You said that where you listed the mifepristone available, was that including CombiPack or was that just mifepristone by itself?
Oh, sorry, those were just brands of mifepristone.
Alone, okay. So when you spoke about the availability in Africa, I think you said it was quite. I remember it was being quite low. So that was just.
Yes, so that we found. We found 5 brands in Africa of mifepristone and 5 brands in Africa of the CombiPack.
Okay, but that obviously okay. And then I had one other. Well, so if we wanted to provide data, for example, we know there's a mifepristone registered in Zimbabwe now. So if we wanted to provide that data, do we just email you directly, or do we email?
Yes, please. That's a good question, and I realize I don't have my email address on my last slide. So I'm happy for it to be circulated after. But absolutely, please do get in touch by email if you have anything to add. We very much appreciate any information like that.
Okay, great. And then I keep thinking of the other question. It keeps going out of my mind. I might come back to it. Don't worry, it probably wasn't. Oh, sorry. No, sorry. You said there was confusion, or the challenge around where you listed the CombiPack. You said it was. Is that because you're listing pre-qualified CombiPack who are only a pre-qualified MISO?
Yes. Sorry, the confusion. Yes. So it comes up in the search. It comes up with a column that says quality assurance status, and it might say something like WHO pre-qualified, and that we have it on the home page. We have some text around that means that's the status of the misoprostol that's inside that CombiPack.
Again,
it's not the whole CombiPack has gone through, and it's confusing, and that's something that that needs to be changed and clarified, because we have already had a couple of questions, and to be honest, I think at the time it was meant to be a footnote, and somehow that didn't happen. So that's what that was about.
Okay, excellent. So yeah, Catherine, I'll email you with some updates, and I just noticed one other thing where you click on a link and it's had 2 manufacturers listed, and I'll take it.
There's an answer for that.
Okay.
Some products, some brands have multiple manufacturers,
but not brands. Brands or?
Oh, I guess I would need to see. Sorry, what you've clicked on.
It was clicking on a mifepristone, and it said manufactured by Beijing Zizou and Lion Pharma.
There's 2 brands called mifepristone.
Yeah, I think we must just clarify that, because I can imagine a manufacturer would not necessarily want that. So maybe it could be a mifepristone 1 or 2, I think, or just something in the text that says it's not one product manufactured alternately by those manufacturers. Yeah, but they're actually 2 different brands. Yeah, it was just a comment.
Thank you.
Okay. Thank you. I hear what you're saying, Tracy. To clarify, they're 2 different products, although they have the same name and 2 different manufacturers.
Yes, I think it's just clarifying.
Yeah, I see here that we have a hand raised from Asa Anderson? Oh, it's unraised. Okay. Florence, do you have your hand raised, please? Florence,
Hello,
you
this is
have to
Asa.
mute yourself. Oh, what?
Hello, may I just? I'm sorry.
Sorry, I was talking with the mute micro. So sorry, I just wanted to know if it would be possible to have the website extract on an Excel file.
Do you mean sort of to download all of the whole
Yes,
database
exactly, yeah.
essentially? And
Mhm.
technically it's possible, but they have not. Our developer hasn't done that yet. And so I think what we're doing for now, and actually that's a really good point. I'm just going to go back and show. So I think if you can see, so for example, if you've done a MisoClear search, you can actually print, if you see that orange button in the top right-hand side, and what that does, that it prints it with a date stamp of that. So I mean, you can do whatever search you want to do and then print the results. But we aren't doing an option for the public to be able to export to a CSV or any other file, because for us that's just a bit too risky. So we have agreed to print results on a PDF with the date stamp.
Okay, great. Well, just to let you know, I did a copy paste from PDF and it to a Excel file. It works, but sometimes it's easier to have it directly from Excel. But it also
Right.
works to do copy paste.
Okay. Thanks. Thank you.
Thank you, Florence. And Inga, I see you have your hand raised. Do you want to ask your questions?
Yes, I hope you can hear me. I think this is a fantastic database, and I think one great aspect of it is the fact that these are reviewed products that have clinical efficacy. I was wondering if there are any plans to have it in other languages, because I can see women possibly using this database, especially in countries where you can possibly buy the product without having to have a prescription or having to go to a doctor. So, for example, at a pharmacy or at, like, let's say, a market. And also, if you have any plans to take images of the product itself, so that a woman or a provider could refer to an image, especially if this information will not be available in other languages.
Yes, thank you, Inga. So yeah, I mentioned before that we don't have any concrete plans right now to translate it, but it's definitely something that's been discussed, and we are exploring the feasibility. I think technically it's possible. We just have to look at capacity and budget and things like that. But we do recognize that this would be useful in other languages. It's an interesting question about the photos, because we have also discussed this, and ideally we would be able to have a photo of every single product. We did take some, so in some of the pharmacies and outlets, some photos were taken, and so we did collect them, but unfortunately the quality of the photos varies quite drastically, and also the number, so we don't have them for all of them. So we decided at the time, since we don't have a complete set of photos that have kind of similar, that look sort of, or have like a similar standard of quality and sort of readability, then we would just leave it for now. And then also we were told we were told by the IT developer that would significantly slow down the search, so we thought for now, let's just keep it sort of usable in terms of the main sort of target audience. And then unfortunately just had to put that one on hold for now.
Thank you, Catherine. And I do see, Asa Anderson, your hand is back up. I don't know if I have your name right, Asa.
Sorry.
Unmute yourself. Yes.
Yes, I'm unmuted. Do you hear me?
Yes.
Yes, we can.
Okay, excellent. Thank you so much. This is excellent. I'm very happy to see that this is now coming and going live. I just had some clarifications around qualities, and I'm sure that you may have discussed this at length, but just for my own information, I didn't understand why there was a fourth criteria added on on the slide that you when you showed around the quality of the products. You know that. So you are looking at also including products that are not sort of SRA or the WHO pre-qualified as well as the ERP. And I was wondering if the reason behind that, because I remember that when we met, well, many of you were probably at that meeting, at the COMEPAC meeting, WHO and CEDA hosted in Jan earlier this year. And we then agreed that we should just, but in terms of quality, we should just use the 3 criteria. So I was wondering the arguments for it. I'm sure you have some. And then just to also maybe inform me, but why there were no quality standards around MIFI. Is that because there are none of them, or so for the mifepristone? So maybe just update me on that. And then I may have missed it, but did you say where you collected the data from? Was this sort of public records, or is it from the IPPF clinics, or partners, or? So I just wanted to know about that. Thank you so much.
Okay, thank you. So I appreciate those very good questions. So I'll talk about the quality first. And this was a very long discussions about the quality, and reference was made to the meeting that you talked about, and talking about the importance to just focus on those 3 international processes for assuring quality. It was just this was just I mentioned it before, but it was basically just to recognize that there are other products out there, and by no means was this meant to ever sort of replace or deter manufacturers from still seeking to have their products go through those processes. It was just really an interim measure so that we could include products in countries where we know that there's a lot of different misoprostol floating around, and none of them have the quality assurance status, and some of them, there's anecdotal evidence of some of them being a bit dodgy and others not being dodgy. So it was more just to sort of have almost like a second tier where we would label it as something, a bit more bland, and it would be clear that whilst this product hasn't gone through one of these stringent processes, it has met other objective criteria around quality. And so that's how that decision was taken. And the question about mifepristone and why are there no quality standards applied to mifepristone, this was again another conversation that we had, and it was just decided that because there's not the documented evidence on it being a product that degrades, that there was not really a need to focus our efforts on that, and so we had to prioritize, and so we prioritized on focusing on the misoprostol, the misoprostol alone, and also the misoprostol included in combi packs. And then your third question about where we collected data, it was certainly not just in IPPF clinics. I'd say the minority probably was. So Genuity and Concept Foundation and IPPF, we came up with a priority list of countries where we decided to collect data, and we split it out. And the data collectors it depended on the country, but we tried to visit a range of outlets depending on what was available in the country. So public and private pharmacies, hospitals, clinics. Some of this did come from IPPF clinics, but really not very much of it. So it was actually in country, going to the actual pharmacies and asking for medical abortion commodities, and either purchasing it or taking photos of it, and either way documenting it as per our criteria in our data collection forms. So I hope that answers your questions.
Thank you, Catherine. There's one more question for you, or at least one more, but the next question that let's see is from Jason Bauer. If you want to unmute yourself.
Hi, thanks, Catherine, and congratulations on the website. It's fantastic. Yeah, just a couple of questions, and in fact, it follows up on both of those, or two of those questions at least from Asha, I believe. So that fourth category and what you call the potentially the second tier products in terms of the quality categorization. And note that there doesn't seem to be any products of that category listed currently in the database. So is that still a work in progress? Have you identified any such products meeting those criteria? And are they intended to be listed? So I guess that's the first question. And also just following up on the availability data collection, have you only listed in the database then products where, as part of that data collection exercise, you physically identified those products? Or have you also included other products which you know or have found out from partners that those products are actually registered and available in specific countries as well? And I guess the third thing, and it's also as the same point as the last comment there, but on mifepristone, it doesn't come up on the search criteria very clearly about that quality, the fact that quality hasn't been considered in listing it there, whereas obviously that's the case for the other two products. And I just wonder if it might be worth making that a little bit clearer when you use the search function. But I guess that's a comment for consideration. Anyway, thanks.
Super, thanks so much for that. I've made a note of your third comment just now, and I think that's a really good point, because we do talk about it on the homepage, but I think people don't read the homepage and then do a search and then go back to the homepage to sort of read it again. So I think that's a really good point, that it could be made clear on the actual search rather than looking like a column that's just gone missing from that one. So thank you for that. Your first question was about the sort of fourth category of quality, and we currently don't have. You're absolutely right that there are currently no products on the website under this category. We are currently in the process of reviewing data, but I can't really say anything else about that. But I mean, it's something that we very much would like to do and would like to continue to do. You know, we welcome independent testing reports of products if you guys have them. We welcome manufacturers opening up to sharing their stability data with us. And again, like I said, this is just the beginning, so hopefully, you know, hopefully we will have more. Your second question was about the data collection and if it was all done in country. Most of it was. So the priority countries that we identified, all of that was in country, where we did this rigorous, very detailed in country collection. For some of the other countries that were mostly in Europe, that was more, I guess, desk reviewed and verifying and sort of triangulating different bits of information that we got. So there were a few that came from various organizations that we checked on, but the bulk of it was in country.
Thank you. And Catherine, I know we're coming close to an end, but I do see here one question that came up in the chat section, which says, asking, do you consider packaging in your quality definition? Something I know we talked a lot about. So.
Yeah, that's a really good question. We certainly collected data on packaging, and I'm just trying to think. I don't know that it comes up in terms of the independent product testing and then the stability data analysis. I don't think it comes up as part of the definition, but it's certainly something that's been talked about a lot, and that we took the information. We haven't actually come to that yet because we've not got any products from the fourth category yet. But that was something that we did talk about at the beginning as being necessary criteria for the misoprostol.
Thank you.
Sorry.
And I think we had created some instructions too. Maybe they're somewhere here in some of the information that's available. But I know we're running over, but there are a few more questions. So I'd like to get a chance to hear. It looks like we have one from Saskia. Do you want to unmute yourself?
Hi, this is Saskia.
Thank
Hi.
you.
Sorry, this is Saskia from Rutgers, IPPF in the Netherlands. Sorry, I didn't introduce myself at the beginning. I was a little bit too late. Just a quick one to build on the last comment that was made. First of all, congratulations on this very informative database.
Thank you.
It's really impressive, and it's a work in progress. And I'm pleased to hear that the group can continue to feed into this and give suggestions, but also I would be interested to hear what kind of information you're still looking for, or if there are particular countries that you still need information from. I think we can utilize our different networks and partners to feed into that.
Thank you.
But my question is really to build on the elaborate analysis that you've been doing in so many countries. Whenever you came across faulty products or non-pre-qualified or even dangerous commodities, would you foresee perhaps in the future to build like a list of like a warning list, like don't take these products, these are wrong products, so that people are also aware of those?
That's, again, a really good question, and again, another long discussion that we had. We didn't in our data collection, come across. We weren't collecting data and analyzing the products. We weren't independently testing what we collected. So I can't say anything about that. But what we did discuss is that if we did find any dodgy products or any sort of counterfeit products or dangerous, we will not put it on our database because it's too much of a risk for us, and we've been advised by our lawyers not to go that route, but that we would have the ethical responsibility to approach the relevant people like the manufacturers and so on. But we also talked about if we do know that there's evidence of a counterfeit product, that we may in a particular country, that we talked about having it listed there, not naming the product, but just to say that there is one that exists, but we haven't done that. So what we do have is a disclaimer around the fact that there are some products out there like that. But right now we don't have plans to sort of identify them publicly on the website.
Yeah, that's clear, and the list may be endless, so you don't know where it will end. So that's very clear.
Yeah.
Thanks.
Okay. Thank you.
And I see, Florence, you have your hand up. I'm not sure if it's from previously or if you have another comment. If you have another question, please unmute and ask it now. Oh, it's from previously. Okay. Well, on that note, I know we're at time, and I know we are at time. And Saskia, do you have another question, or is that an old hand? Okay, maybe it's the previous. So I know we're at time. I apologize. Natalie was hoping to lead us through some updates on our SAS work plan, but we are now at the end of the webinar, and I know other people have things to do. So we will be planning a teleconference in the month of November, and later today or perhaps tomorrow, we'll send out a save the date for everyone to join. And at that conference, we'll have an opportunity to share more about institutional updates leading towards this larger safe abortion supplies effort. So I'd like to close first by thanking Catherine so much for an excellent presentation and also being able to manage so many complex and comprehensive questions from this group. I think this is the right group of people to definitely be getting probably a little bit of the range of all the types of questions you're ever going to hear about when it comes to a commodity database. And now you're ready for any other future presentation. So thank you for that. And also to make a call out to everybody to just, if you haven't had a chance to take a look, that there was a very nice social media campaign that the Supplies Coalition put out last week, recognizing Safe Abortion Day, on their website and also on Twitter and other social media. So if you haven't seen some of those, it's not too late to take advantage and to pass those along within your networks. It's nice to see this issue sort of at the forefront within this coalition. So we wanted to recognize that. Are there any further closing comments from either Alex or Natalie or Catherine?
No, none for me. Thank you very much for this opportunity.
To say thank you so much, Catherine, and to Jennifer and Natalie for helping to organize this. We will send out as soon as possible a link to the recording of this webinar, along with, as Jen mentioned, the save the date for our next teleconference, where we can have more space for questions about the database if Catherine is available to join, and institutional updates and other agenda items. Additionally, we will share Catherine's contact information, so people who have been asking on this webinar where can they contribute updates to the database, you can speak directly with Catherine on that. And that is all from me at the Coalition. Thanks so much for joining.
I echo the thanks as well. Thank you. We look forward to speaking to you all in November.
All right. Goodbye.
Bye. Thank you.
Thank you.